Okay, let's try round 2 of recording this. Thanks for your patience. So let's start off with my learning objectives for this. Basically, we're going to talk about various different theories of psychological development and kind of go through some implications of that today. As far as an outline for what we're going to talk about, we'll be going over psychodynamic theory, kind of the Freud stuff, and discussing subconscious personalities, cognitive defense mechanisms, and some of the implications on current psychiatric practice. I'll also go over the behaviorist perspective, which includes classical conditioning and operant conditioning, as well as cognitive behavioral perspective and some of its implications. We'll also hit humanistic perspective and also talk about Maslow's hierarchy of needs. Before we really dig into this, I think it's important to recognize that these are kind of perspectives relating to an understanding of what is going on in the brain that elicits behaviors, that connection, and trying to understand why a person behaves the way they do, based on what's going on in the brain, both consciously and subconsciously. So I'll kind of talk about those. Starting with a psychodynamic theory, this is kind of Freud's baby right here. And the idea behind most of it is that within our brains, there is a unconscious portion that dictates a lot of our thoughts and our actions, kind of called like almost an internal dialogue, and sometimes can be contentious. So, this is part of how our brain functions and understands the world around it. And so we'll kind of go over some of the players in this as far as the psychodynamic theory goes. Just so to start off, let's talk about the id. So id's kind of, in this theory, defined as the kind of basic, primal drives of a person. What's making them run, what's making them tick. This is really just in the subconscious. It's not really anything we can access or control necessarily, but it's related to pleasure, gratification. Freud discussed a lot how this is often driven by sexual instincts. And, as newborns, all a baby wants and needs are those primal things. Food, getting out of a dirty diaper, things like that, sleep. So their entire existence is really weighed more heavily by the id. And then as we get older, as kids get older, they start having this kind of counterbalance, which is called the ego. And that's more of it takes into account a lot of those external realities that we have to deal with in life. How to obtain food, how to get along with other people, things like that. Unfortunately, with just these two players here, there's kind of more of a seesaw effect. It's not necessarily a balance if there's just these two, according to Freud. So they'll kind of just seesaw back and forth of what their priority is. Are they willing to work hard for the ego, or are they going to be driven more by the id? And that's pretty clear to see in the behaviors of children. And then sometimes adults get stuck with this as well. If somebody develops correctly, then the superego becomes a player, and it's kind of what we imagine for ourselves. And, it's kind of our judgment, our conscience, our a template for our behaviors. We also kind of use it as a template in how we view other people. And so these three states are kind of at tension. In tension between each other, and they're not necessarily one winning over another, which is pretty good. So if you've got an impulse or desire by the id, for instance, to go drinking or something that would have a primal satisfaction, often the superego can kind of help balance that out, and with the ego in the middle, it doesn't allow us to get too far in either direction, which is good. And so I like to think about it as kind of like this three-way balance between the three. Because if you just have the id and the ego it's just going to kind of seesaw back and forth. But if you add the superego, morals, things like that, it kind of brings a little more balance. And according to Freud, most all of this is just within our unconscious. We're not really aware of it. And I mean, that kind of brings up the idea that most of Freud's therapeutic attempts at helping patients was related to trying to bring things to the conscious, or interpreting things such as dreams to try to understand what's going on with the id, the superego, and the ego. So one of the ways that he kind of viewed the interactions between the id, the ego, and the superego was when a person has kind of cognitive defense mechanisms, which are when there's an anxiety or a discomfort in our subconscious, our conscious and or conscious self, the ego kind of tries to moderate that with defense, which makes sense. And kids, these are way more prominent because they really haven't developed the superego to kind of have more mature reactions to life. And so some of them, like I said, depends on a person's age and psychological maturity. And then it also just kind of depends on other factors like anxiety. And we consider some of these defense mechanisms more mature because they don't really compromise functioning and actually allow someone to function a little bit better. But at the same time, most of them are, to some extent, not great. So we'll talk about some of the more primitive ones, as well as some of those more mature ones. Starting off with some of the primal, immature defense mechanisms. One of the first ones is acting out, and best example I can think of is a kid. They act in a defiant or unacceptable manner, even if it's not for their own benefit, because they're feeling subconscious stress or anxiety. It's not necessarily a conscious thing. Okay. Avoidance, that's usually simply ignoring or avoiding things that are uncomfortable, and that's a pretty common defense mechanism in kids and even in adults. Okay. Denial, that's behaving as if something is not true. So to some extent, Freud would say that extreme denial, delusions, is essentially just denial that's kind of in an extreme form. Identification, or also called introjection, is when we mimic the behaviors and attitudes of those around us without realizing it, again, kind of in our subconscious. And so when we look at this, we're recognizing that it's not necessarily a bad thing to replicate the behaviors of those around us, but can be a negative thing if we're not able to control that. Regression is the idea of kind of going backward in psychological development. For instance, a kid moves when they're 5 years old, far away from where they were born and things they know, and so often they will regress to an earlier behavior, such as thumb sucking or wetting the bed after having been able to not do that for years. And so regression can occur in those situations. Some of the immature but kind of more complex defense mechanisms includes passive aggression. Sometimes this can be a little bit more in the conscious self, and it's kind of expressing yourself hostilely, but in a way that kind of hides it, tries to hide it at least. Doesn't want to have the appearance of aggression while still expressing an internal emotion. So there's the internal hostility and aggression, and it's acting that out, but without actually wanting somebody to know that there's that aggression. Projection is when a person feels an impulse or a desire, and doesn't necessarily act it out, but instead projects that feeling onto somebody else. So for instance, if you hate somebody because for whatever reason, if you're projecting and Freud would say you don't want to acknowledge that within yourself, you would project that the other person hates you instead. And sometimes it's kind of an excuse for your own feelings, but most of it's kind of a subconscious thing. Rationalization is kind of what you'd think it would be, but more than anything, it's trying to reconfigure an unacceptable or inappropriate desire by making it seem normal or desirable and making it seem acceptable. Just rationalizing what you're doing. Some more of those immature but complex ones. Compensation. This one is where whether it's purposeful or not, if there is a failing or a perceived inadequacy, a person would compensate in this manner by exaggerating in another area of their life or behavior. So trying to kind of overcompensate, trying to display another attribute to kind of overcome or overshadow a failure. And like I said, that can be kind of a conscious thing. Actually trying to project that as opposed to just happening without consciously knowing. Splitting is a really interesting concept. This is kind of all or nothing thinking, and we'll kind of go back to this a little bit later in another one of these, another theory later on. But it's the idea of only recognizing the positives or negatives of a person or situation. This is generally kind of more of an unconscious thing. Somebody who's splitting doesn't necessarily realize that they're doing it. They're not purposely doing it. And this is a pretty common thing when it comes to borderline personality disorder. Last one here is transference and countertransference. This is when you have a certain kind of feeling or desire for someone, or a feeling or desire you had for someone. Freud would say it's often related to something that happened in childhood, a feeling you had towards somebody in childhood, love or hate or whatever it might be, and putting it or transferring that emotional feeling towards somebody else. Often that's seen in a therapeutic relationship with a patient, in that they might feel love towards a therapist or a medical provider, or conversely, they might feel hate, and they're transferring that emotional feeling that really is for somebody else onto a different person. And then countertransference is actually when a therapist, to some extent, transfers some of their own emotional feelings for whatever reason from themselves onto their patient. And that's actually something that the clinic I work at has us do training on countertransference to help make sure that we are not interposing our own feelings and our own emotions onto the relationship we have with our patients, so that we can keep a professional relationship, as well as to prevent us from kind of getting burnt out by having that kind of transference back and forth between patients and ourselves. Some of the somewhat more mature repression. This is one subconsciously where memories are just kind of blocked. We don't really remember it. Freud would say that it's a subconscious protective mechanism, and can happen when there are significantly uncomfortable events. To be honest, a lot of times it'd be nice to have this as opposed to things like PTSD, where it is always present in a person's mind. And so repression is just not even being able to recognize it, and it's not a conscious decision to do so. Displacement is when a person will kind of essentially move or place a thought or a emotion from the real cause of distress, something that's hard in their life, and they'll move it and displace it from that concern to something else. Sometimes it could be a person, but for instance, if you've got a lot of pent-up emotion towards your boss at work, and it's unacceptable to punch your boss, which it is, going home instead of punching your boss, going home and punching your dog, which is not an acceptable thing to do. And so hence why this is not a super mature mechanism. And you don't even necessarily need to punch them, but at times this is just displacing of feelings, where you hate your boss, so instead you go home and you hate your dog. And if Tyler's watching this, I don't hate you, Tyler, just so you know. As far as this last one here, reaction formation, this is where it's almost a reactive response to an unwanted impulse, replacing it with the opposite. And so at times, if somebody has, it's kind of a trope in books of, somebody who is in love with a person they can't ever have. And so instead of loving them, they hate them. And so kind of having an opposite response, because it's not appropriate for them to love that person who they can never have. And so that's reaction formation. Some of the more mature ones, arguably, include anticipation. That is either conscious or subconscious attempts to prepare for potentially anxiety-provoking situations, and being prepared and problem solve beforehand. Sometimes it's a specific decision to do so, but a lot of times, without even realizing it, people will have this defense mechanism of anticipation, where they are going to Thanksgiving dinner around people they know might be kind of triggering, and without even realizing it, they will sit far away from them at the table without even purposely doing so. Okay. Another one is humor, trying to use comedy to redirect emotions or painful thoughts. And so instead of, feeling deeply negative emotions related to a loss of somebody they loved, or death, things like that, then using humor. Sometimes it's self-deprecating, but other times it's just trying to create humor in situations that are negative or painful, and sometimes that can be a pretty helpful defense mechanism. Suppression is different than repression, whereas suppression is consciously blocking undesirable thoughts or impulses, gaining control of that. There are patients who suffer from various pedophilias, which we'll talk about, or things like that, often can use suppression to completely block those out. Doesn't necessarily mean that they don't have them come up, but they're able to suppress it. And the last one here is sublimation. And this is when a person kind of channels an impulse into socially appropriate activity. So different than, punching your boss. This is, wanting to punch your boss or punching your dog. It's, you have stress at work. You're feeling really upset about something that happened. And so you go home and you punch a punching bag, or you go for a run, or you listen to music. And so ways to reduce internal anxiety. This can also be a subconscious thing that occurs without even meaning to, but your brain just can develop actions that will sublimate those impulses in ways that are acceptable. So how does psychodynamic theory impact things today? It still has quite a bit of an impact. Many of his theories, Freud's theories, were debunked or found to be less useful as we understood the psyche a little bit better. Some of his practices were unethical, but at the same time, much of the research and the study that he did prompted further study, whether it is reactionary to what he said or whether it was building off of what he said. There's a lot that is in current psychodynamic theories or psychological theories that came from Freud's ideas. So we can be grateful for that, and grateful that we're not sitting in a clinic trying to interpret somebody's dreams. But at the same time, understanding some of these cognitive defense mechanisms, which to some extent are true and real things, can be really helpful in current practice. The next perspective is behaviorist or behavioral. This isn't the idea of learned behaviors or learned associations. We call that conditioning. So the idea in a behaviorist perspective is that all of our actions, beliefs, and behaviors are acquired to some extent. And they're acquired because we've been conditioned by things around us, by things happen in our life, things that are taught us, things like that. And so behaviorists will focus mostly on behaviors. They do less to examine thoughts or feelings, and it's more about conditioned behaviors. And so part of their desire was to create create psychology, or help psychology be more of a scientific field, trying to come up with objective things that can be seen, can be measured, as opposed to Freud, whose ideas was a lot less objective and was more subjective based on how it was interpreted. So that's kind of where behaviorist comes from. Two of the main ideas that we'll talk about related to the behaviorist perspective, and they're just two parts of a whole, are classical and operant conditioning. So start off with classical conditioning. You'll see some UR, US, CS, and there's more definitions in the next slide related to these. But the idea being that responses are physiologic or behavioral. And so some sort of response it will naturally be elicited by a stimulus. For instance, you stub your toe, you pull your foot away from where you stubbed it. That's a natural impulse. And the idea being that if you have a second stimulus that occurs, at the same time as the others consistently, that second stimulus will also elicit a response. I actually have noticed that when my foot hits something, often I will go, ouch, without even thinking about it, even if it doesn't actually hurt, because ouch is what I will kind of naturally say when I stub my toe and hit something when it hurts. And so kind of without even thinking about it, my foot pulls away and I say that, even if it didn't hurt. It's kind of a response. So a lot of this comes from Pavlov for classical conditioning. Remember the story of Pavlov and his dogs, where his dogs were exposed to meat and it caused them to salivate. And initially that was, you had that was a natural response, meat causing salivation. It's physiologic. But what happened is he began ringing a bell every time the meat was showed to the dog or presented to the dog. And so the dog would salivate because it's seen the meat. Well, over time, as the dog was continually exposed to meat and the ring of the bell at the same time, the meat was not shown, but the bell was rung. And so the dog would begin to salivate even when there was no meat, just because of the ring of the bell. So let's define some of these parts of this classical conditioning. So the idea is that the unconditioned stimulus, so what's stimulating, is whatever is causing a change in behavior or thinking or feeling. So in this case, it's the meat, right? So dog seeing meat is the stimulus. The unconditioned response, or the natural, I like to call it natural stimulus or natural response, that's what would naturally happen when that stimulus occurs. So meat, you get the dog salivating, right? Conditioned stimulus, that's something that's neutral, something that would not cause any, or at least not cause that response. And so in this case, that conditioned stimulus, the one that's neutral initially, is the bell. A dog may have some reaction when a bell is rung, but definitely not salivating. So it's initially not. It's initially a neutral stimulus, but becomes conditioned to create a conditioned response. And so that's the new response that conditioned stimulus performs, which, i.e., salivating. And so The bell goes from not causing any reaction in the dog to causing it to salivate as it's been conditioned. Okay. A couple ideas related to this. One is that often when there is classical conditioning or just any sort of condition response, and if there is a natural response to A, and it causes C to happen, often if B is super similar to A, it'll also cause C to happen. And so, for instance, the idea of for a dog, if it was shown a picture of a piece of meat, even if it's not the meat per se, it's similar enough that the dog potentially could have some sort of generalization of the response. And then extinction's a really, really important one, and is a part of how we treat mental health disorders, is the idea that a response that has been conditioned, meaning it's not natural, it's not something that's inherent, can go extinct over time, essentially forgetting a response that has been conditioned, so that you no longer have that conditioned response to the conditioned stimuli. The idea being that, if you were to be having some sort of panic attacks every time you see a picture of me after you graduate from PA school because it brings too many hard memories, eventually over time, if you see a picture of me, you may not, you're not going to have any sort of class with me, and you're not going to have any sort of negative impact. And so slowly over time, you might see a picture of me on Facebook or whatever and not have a negative response, because that no longer has that conditioned response associated with anymore, so it can have extinction. And this is, we use this a lot when it comes to things like PTSD and anxiety disorders, panic disorders, trying to help somebody get over phobias and things like that by kind of extinguishing a negative response related to something like that. So for instance, my daughter hates spiders. Naturally, a baby would see a spider and try to eat it, right? And my 1-year-old would try to do that. But my 10-year-old, on the other hand, freaks out and jumps up on the counter. So, as far as trying to do extinction of that response, well, exposing her in a safe environment to benign spiders, or fake spiders, or just slowly trying to help decrease that autonomic response or feelings by helping kind of cause extinction. Okay. This also can be, thinking about conditioning, realizing that addiction and things like that, there's no normal positive response related to sticking a needle in your arm. But after a significant amount of time where you have a positive physiologic response to the needle in the arm, at times they can have a conditioned response just to having the needle placed in their arm. Almost to the extent where a person could have significant hypotensive or vasovagal response to an injection because their body's preparing for that, a drug or something like that, and it doesn't come. And then, thinking about how do we use this to treat those, and I mentioned that a little bit. So something that is important is that the idea that if the stronger that unconditioned response is, the faster that learning is going to be. So for instance, think about car accidents, terrifying car accident. It doesn't take more than one terrifying car accident for there to be some sort of conditioned response to, a car braking in front of you on the freeway or something like that, right? And so pretty quickly you can have that response, which is pretty negative and can cause some, PTSD symptoms related to that. Unfortunately, it's when there's a significant fear response or something like that, it's hard to unlearn that. Whether it's a fear response or even a positive response, if you've had the positive response of using drugs, alcohol, things like that. If you're kind of conditioned to the positive response related to those, it's a lot harder, like I said, to unlearn those. But they can be. The second part of this behaviorist perspective is operant conditioning. It's not necessarily, the opposite of classical conditioning. It's kind of a second part of this. And this comes from the work of B.F. Skinner. I'll talk a little bit about him and his rats. But the idea of this is that our behaviors and emotions, to some extent, are affected by when we've received specific rewards or punishments due to something that we do. So with classical conditioning, it's more related to autonomic responses in response to situations, kind of like with the dog salivating. Whereas with this, it's looking more at changes of behavior, okay, and learning and prioritization of needs. So Skinner had his rats, put them in a box, didn't give them enough food. Then he placed a lever in that box where if they pressed it, food would start coming out. And so, the rats initially would do it by accident, but then over time they realized that when they did it, there was a positive response. They were receiving some sort of reward. And so it reinforced that behavior until they would press that bar. And over time, they would continue to press that bar, even after it stopped putting out food. And so this is that idea that in life and for all of us, as behaviors are rewarded, we repeat them more likely. If behaviors are punished, we repeat them less likely in general, okay? And so that's the idea behind this operant conditioning. And when we look at, like with Skinner's rats, if they are conditioned pretty consistently over a long period of time, it takes a long time for kind of extinction of that behavior to resolve. And so extinction also can apply here to operant conditioning, but it can take some time for that conditioning to go away, if to be extinguished if it's been reinforced often. And we'll talk about some of the behaviors with that. Some definitions. So when we're talking about reward, punishment, whether it's positive or negative reward, when we think of positive punishment or reward, that's when something is added. Okay, so when we think about the rats, if there's something we want the rats to do, press the lever. We are positively giving something. We're giving them food. Whereas negative, that's when something's taken away. So with a kid, this is like timeout. So taking away their a privilege that they already have. Okay, and then they can relate to both punishments and reinforcements. So a punishment is any sort of stimulus that decreases behavior. Okay, and reinforcement is a stimulus that's likely to increase behavior. Okay, and so you can combine all four of these: positive punishment or reinforcement, negative punishment or reinforcement. Okay, so we'll look at a couple examples. So positive reinforcement, that's when a stimulus is provided, again, something added, that will increase the probability of them doing it in the future. So if I want my kids to do their chores, if I give them, a hug or give them candy or money, that's kind of a positive reinforcement. Okay. A negative reinforcement would be removing something to increase the probability of them doing it. So this would be if I want them to do their dinner chores and they're not doing it. Well, a negative reinforcement would be, okay, if they don't do it, I'm going to take away their screen time that day or the next day, or something along those lines. As far as for for punishment, it's going to be similar. Giving something, a spanking is kind of a positive punishment if we want to decrease them from doing something. Whereas a negative punishment is, if we want them to not, do something, then we'll take something away from them that they like. So anyways, there's some examples there. Another couple ideas that are important to this theory is the idea of discriminative stimuli. So that's when, there's a stimulus consistently used with a specific response. And because of that, it increases the probability of a desired response. And so, to some extent, it's kind of the idea of it's not necessarily the stimulus itself, but it's something that helps discriminate or predict that a stimulus will occur. And so that's something that kind of helps guide our behaviors. And then we talked about extinction already to some extent, but when a behavior is no longer reinforced, it's going to slowly be extinguished. So with the rats, it's the idea of if they press the lever and they don't get any more food, well, eventually they're going to no longer be pressing the lever in hopes of getting food. Just like with my kids, if I no longer give them a reward for doing their chores, they will likely stop doing it. Okay. Often the extinction will take longer if a stimulus has been given or extended for a significant, or reinforcement's been given or for an extended amount of time, especially if it's intermittent. It's similar to when we talk about make it stick, the idea of remembering information, where if you learn something once today, again tomorrow, again in a week, again in 2 months, again in a year, right? At that point, you have, it's been a lot more ingrained, as opposed to, learn it today, tomorrow, the next day, and the next day, and the next day, and the next day, and then not again. It's going to actually extinguish faster than if you have kind of an intermittent, unextended period. Same goes with this extinction. For the rats, if it's the idea of, okay, give them food every day, and then even if you start slowly giving it every other day via the lever, and even moving it further and further away, but going for a long period of time, you can create that response. And so, for instance, if you had rats that had been conditioned for a super long period of time, and you went a week between having that, the pressing the lever down and getting a response, and going 2 weeks, and then 3 weeks, and then a month, and then a year, you could potentially recondition them very quickly to that response after a long period of time. It's not like they have to relearn that response if it's been given over a kind of extended period of time. Secondary reward conditioning, that's when something else besides the actual stimulus is used to create response. So, if you go to a casino, there is no benefit to a casino chip. Physically it does nothing. But the idea of getting more of them has a significant response, because even in the unconscious, that it will derive money, right? Or even money itself. A dollar bill does nothing for you. You can't eat it. Provides no positive response. But you see a big envelope of cash, you're going to have a response of feeling like that's a big bonus. And so there's a lot of things that have a secondary reward conditioning, and that can be helpful with kids, and things like a token society of giving tokens to kids that are associated with good behaviors, and those tokens can be used for other things. And then avoidance conditioning, that's the idea of, especially with dogs, if you like a shock collar kind of thing, that you put around around your fence area of your yard, and if the dog crosses that line, they get shocked. Eventually, they'll kind of have this avoidance conditioning of crossing that line, even once that painful stimulus is taken away. So how do we use this? Well, trying to desensitize a response, a conditioning, like we mentioned. Aversion therapy, that's kind of where we try to help a person give up a behavior, habit, feeling, thought, by creating an association with something more negative or uncomfortable. If anybody's heard of antabuse, antabuse is a medication that's given with patients suffering from alcohol use disorder. And what it does is, if someone tries to drink while taking antabuse, they have a significant adverse, uncomfortable reaction to that, which will it decreases their desire to want to drink, and is helpful. And even after we take away that antabuse, often they still have that kind of same response to thinking about drinking alcohol. But often we just continue patients on it for long periods of time. And then contingency management, that's where, in a clinical setting, we reward patients when they perform certain positive changes. So in addiction, it's like if the patient comes in for drug screening, they get a $50 gift card, or if they come in for their medication or things like that. And so that's kind of a positive reward system, and it needs to be in a kind of controlled setting, but often people try to do it for themselves. So for instance, if I'm trying to eat more healthy, I try to create a contingency management where I reward myself when I eat well throughout the day by letting myself eat something yummy at night, or somebody might put $1 in a container when they go without smoking for a day. So that can be some self-contingency management. Next is the cognitive behavioral perspective. This combines some of the ideas from the previous perspectives. And the main premise is that we're not just creatures, we're not just animals that are conditioned one way or another. We're a lot more complex than that. And our conscious thought and ideas and beliefs and morals has a lot of input, and it causes a lot of what drives us and causes us to do one thing versus another. And so often this is still some subconscious areas, but a lot of it's conscious. Okay, there's definitely a cognitive process that leads to our behaviors, and we are developed and shaped by our environment, and how we perceive and interpret our environment leads to our actions. So in general, when we are making a decision, any sort of decision, whatever it might be, initially we gather information, and it's not usually a conscious effort, but it's the idea of all the inputs that we have is gathered in order to make the decision, and based on what information we gather, we have our behaviors, right? And it's a little more complicated to that. So as we gather input, we process it based on pre-existing ideas. It's sorted based on priorities, and there's a lot that leads to our interpreting it. Okay, using our assumptions, belief systems, things like that, and that leads to our output. It's not as simple, when it comes to just information output. I mean, just the behavioral perspective could kind of lead to an understanding of this, because you got input equals output based on how we were conditioned. Well, there's a little bit more to it, and so this is kind of a deeper understanding of that. And so as we go through this, good to be thinking about where can this process go wrong. If there is incorrect information that's been gathered, or there have been inputs previously that have yielded results that are not normal, or responses that are not normal, or we have assumptions of how things should be, it can lead to a different behavior than would naturally make sense, just based off conditioning. Another way to look at it here, how our thoughts and feelings and actions are done. So we'll talk about cognitive distortions, and this is looking at some of those areas where our actions and our thinking are incorrect or flawed. And this is based on kind of both conscious and subconscious beliefs and ideas. Often there is some area of conditioning or reinforcement, and when we have distorted thinking, it's usually related to some sort of negative thoughts, emotions, or reactions to what's going on around us, and it causes some kind of distorted view of reality or of our assumptions. So first one I'll mention is magnification or minimization. This is when we magnify or minimize the significance of something, and when we're looking at, my wife texted me and, texted me a frowny face. Magnification might be me saying, oh my gosh, my wife doesn't love me anymore. Everything's going bad. Whereas minimization, my wife might text me, she wouldn't, but if she texted me and said, Brad, I'm leaving you, you're a jerk, I can't believe you did this to me, I might minimize that by saying, oh, that's nothing. It's not a big deal, okay? It's not significant that she said that to me, okay? Catastrophizing is kind of a version of this. Often it's related to when we have some sort of event or something's happening in our lives, and we might just assume or predict that the outcome has to be negative. There's no way this could be a positive thing. And often we catastrophize about the things that we've said or things that we have done. So, I say something stupid at a meeting, I might catastrophize by saying, oh my gosh, they're going to hate me, I'm going to get fired, there's no way they're going to let me come back tomorrow. That's kind of the idea of catastrophizing. And that's kind of a magnification of an event. Abstraction and selective abstraction, that's when we kind of conclude how something's going to go just based on a single piece of data, despite having other pieces of data. So, you've got 10 reasons why, your wife loves you, but then the one little thing that, makes you wonder if she does, you select that and you focus on that and you conclude things based on that. And that can be dangerous because if our brain just automatically focuses on things that like that, it's hard to move past that. Overgeneralization, that's when we have something that occurs, and usually it's just a single event, but we infer what that means just based off that single event. Okay, so the idea of one person told you that they don't like you in a peer review or something like that, and just overgeneralizing and thinking everybody doesn't like you. Another kind of thing similar to this is jumping to conclusions, and that's there doesn't have to be any evidence to go off of, but when we jump to conclusions, it's just you don't have evidence, but there's some sort of internal anxiety or feeling that makes us assume that about what's going on. One of the examples of this is what we call mind reading, and that's when we conclude that we know what somebody's thinking about us, or we know what they believe about us. And so, an example would be that, I don't know why, but I know that driver next to me is so mad that I'm driving slow, right? It's and it can be benign, but sometimes it can be significant where we just believe something strongly without any real evidence. Another one is these should or must statements. Sometimes these are just subconscious, and other times they're a conscious thing where we're saying it and thinking it, but it's essentially telling ourselves that things have to be done this way, or things should have or could have or not could have, should have been done this way or must be done a certain way. And so, when we're looking back on actions that we've done, often when we think about a should statement, it might be something like I should have known that when I recorded it on that one program, it was gonna not work. I should have known that. But that's not accurate, right? I couldn't have known that for sure. I could have known that maybe, but I should have? No, how could I have? And so that happens a lot, and especially with relationships or with, behaviors that are not, going the way we'd like to. I should have taken the trash out. No, I could have taken the trash out, or I should have said something to that person. No, I could have, and so challenging that is something that could be really helpful, and kind of not forcing ourselves to not letting ourselves believe that it's a should. I should have done this, because it ignores all the other circumstances surrounding the event. It really just hyper focuses on that one thing. And polarization can be similar to that, and it's kind of we talked about it kind of earlier, the all or nothing thinking with Freud, and idea of polarization is just that everything's good or everything's bad, and it's kind of, it's a all or nothing thinking. You can't recognize that there can be good and bad to a situation or to a person or things like that. Fallacy of fairness, that's kind of feeling that for sure, I know that this situation has to be fair, and there's no other way around it. And so when things deviate from fair, it really affects our emotions and our feelings and our actions. And so definitely a source of conflict when we believe deeply that something has to be fair in a certain way, when that may not necessarily be true, and we may not have all the information. And so another is personalization. That's when we take blame or even credit for something that's definitely not our fault, or definitely not all our doing. And so and this happens a lot, especially with trauma victims, where they personalize events surrounding abuse or trauma and feel like it's all their fault. Blaming is kind of the opposite. It's where we blame somebody when it's not their fault, and it's usually kind of a subconscious thing, and where we don't really want to take responsibility, or we want to demonize somebody or an action or behavior, and so we will blame another person, essentially. And last one here is emotional reasoning, and that's when a person believes that the way they feel about something or the way they think something is the way it is. And so, I feel hate towards a person, that means that person is bad. Or I feel like tomorrow is going to be bad, so it's going to be bad, kind of thing. Those are simple kind of examples. Last part of this is, another cognitive distortion is automatic thoughts, and those are thoughts that are outside of our conscious domain. A book I really like is called Thinking, Fast and Slow. So Thinking Fast and Slow, and it delves into a lot of these fallacies that kind of control how we view things. So, and they can affect a lot of things with our mood and actions. So, for instance, the idea that, you'll have a thought that just comes up based on something that happens. So, if you say something stupid to a friend or whatever it might be, often you'll have kind of an automatic thought that just pops in your brain without realizing it, and it is just there, and you can't get to go away. Like, I'm so stupid, or that was so dumb, and you're not even in conscious control of those thoughts or feelings. Okay, and those can be pretty difficult. And the last is cognitive biases. This is also talked about in that book, Thinking Fast and Slow. First part of this is heuristics, and these are mental shortcuts. They're not conscious mental shortcuts, but shortcuts in our brain to be able to deal with life and deal with things more easily and quickly. And so it's kind of generalization of things often to try to be able to solve problems in our life, and it's a useful thing. Unfortunately, it can create these cognitive biases where we misinterpret data or information. A couple of these that kind of are applicable here. One is anchoring. That's where we kind of anchor onto one piece of information that we feel drawn towards. Another one is availability bias. That's where we kind of believe something is more likely to occur than it actually is, because it comes more easily to our mind, whether it's association with a word or we've seen an experience like that. And then confirmation bias is more along those lines of you've seen it, you want it to be true, and so you seek data to confirm that. And so often that's a danger in medicine, where we kind of look for a confirmation. We have a confirmation bias where we really want to believe that this is a true thing. So all the data that we keep in our brain is data that confirms that. And any data that is against that, we are going to ignore it. Okay. And then framing is where we kind of, we get a piece of information, and depending on how it's presented, we draw different conclusions, even though it's the exact same piece of information. And that happens pretty often. So how does this relate to mental health? A lot of mental health disorders will kind of initiate or develop from some of these cognitive distortions, such as depression and anxiety disorders. A lot of times with depression, there's a lot of those um, negative thinking and all or nothing thinking that can relate to that. And anxiety disorders, a lot of that is related to condition responses. So, and then when we try to, move past this and to treat these, often what we're looking at is trying to challenge or overcome or recondition some of those negative distortions. Last perspective here, a humanistic perspective. And this kind of comes in reaction to some of the behavioral ideas of we're just creatures that are conditioned one way or another, trying to not compare us with animals, and at the same time, trying to view mankind in a positive light, saying that a person's essentially born good, and if given the right nutrients, like a plant, they're going to mature and they're going to become a healthy adult. And it's interesting that a lot of the study when it comes to humanistic perspective is, studying healthy adults, and as opposed to studying those with mental health disorders. Because with a lot of other perspectives, the study is of those who have disordered thinking, and so that skews how the view of humanity. And so, with humanistic perspective, aiming to look at what can become the positive ideas. So again, people are essentially good. People have a tendency to progress towards self-actualization, and we'll look at Maslow's hierarchy of needs in a second. And the goals when it comes to therapy is to help people get to that self-actualization. Okay, part of also the therapeutic alliance is not treating people as if they are disordered, but treating them with kind of a positive regard, and more acceptance than trying to change things. And it comes back to this kind of hierarchy of needs where, if we can satisfy somebody's, desire for physiologic need and safety, security, help them find love and belonging, a person will reach that self-actualization if they're able to be nurtured in an environment that allows them to feel love and belonging and self-esteem. And so, with children, this is something that is encouraged highly to help create safety in the lower areas so that they can develop towards self-actualization. And when you look at adverse childhood events, ACE scores, often you see that they were lacking some of those lower level things as children, and it's very hard for them to reach self-actualization as adults because of those adverse childhood events. And so, thinking the idea, how do we help patients prioritize? Okay. There are other factors that we need to be considering, right? Besides just where is it at on the pyramid? Is it urgent? How easy is it to fulfill a need, or how difficult, right? Are there barriers or are there resources? Has a person had a positive experience and they have confidence that they can fulfill a need, or have they had a negative experience and have no confidence that they can? Additionally, what's their insight level? Are they aware? Do they even realize that they're lacking in a specific situation or circumstance? And then, just thinking about how does this apply when we're trying to take care of patients? How can we prioritize patients' needs, and thinking about how our healthcare systems can direct resources. Last little part here, I have a whole lecture on psychotherapy coming up, but the idea is that psychotherapy is an attempt to utilize some of these perspectives to help identify and help a person work through some of these negative emotions, thoughts, and behaviors. And, because a lot of our patients with mental health disorders, there is some disorder of emotions, thoughts, or behaviors. And so If we can help challenge those, if we can help a person work through those and identify where those emotions, thoughts, or behaviors are coming from, we can help them work through, adapt, give them skills. And so the best kind of therapies are collaborative, where they're working with a therapist. The therapist, is hearing what they have to say, and it's a dialogue. And it's not just the therapist telling the patient everything. It's also not just the patient telling the therapist everything. It's not just talk. It's a dialogue because it's helpful for the patient to talk through some of the things and work through and identify problematic thoughts and behaviors and emotions. But it's also helpful because the other direction, to have the therapist teaching, helping give the person the skills and the ability to reframe their thoughts and to channel their emotions and things like that. So, and we'll talk about that in the lecture about psychotherapy. But here's some resources that you can look through. And then if you want, there's extra material after this about existential perspective that you can read through if you really like to, as well as a kind of a case study that I encourage you to look at, but not necessarily testable material, but something that would help you. As far as testable material related to this, we'll go back up to the learning outline again, and think about when it comes to each of these theories, if you can sit down and explain the basis of psychodynamic theory, if you can explain basically the id, ego, superego, just which is which, right? Be able to match them up. As far as the behaviorist perspective, being able to define what classic conditioning is, operant conditioning, being able to look at those and explain, what is the unconditioned stimulus and unconditioned response, what is a positive reinforcement or a positive punishment, right? With cognitive behavioral perspective, looking at those, kind of the general idea of it, as well as the cognitive distortions. As far as those long lists of defense mechanisms and cognitive distortions, I encourage you to be able to go through those and give a basic, just kind of, very basic idea of which each of them are. Being able to understand those can be very helpful and beneficial. So be able to go through those and give a basic idea of which of those are, and then just kind of the basic principle of humanistic perspective and what that is, and Maslow's hierarchy of needs. So, all right. Well, thank you guys for your patience, and hopefully this is helpful for you.